All right, today we're diving into a threat that's not some far-off virus. It's a danger that could be hiding inside a lot of us right now. We're talking about hospital superbugs and the story of how they go from just hanging out to becoming deadly invaders. It's something you really need to hear. So let's get right into it.
And this really is the big question, isn't it? I mean, trillions of bacteria call our bodies home, and most of the time, everything's fine. It's a pretty peaceful coexistence. But what happens when some of those microscopic roommates decide to turn on us? What's the tipping point?
Okay, so to figure out how things can go so wrong, we've got to meet the main characters in this story. And what's wild is that these aren't some kind of foreign invaders. Nope, they're actually part of our body's normal setup. So let's name names. We're talking about a trio of bacteria here: Klebsiella, Enterobacter, and Serratia. Now, they belong to a group called gram-negative bacteria, which really just has to do with the type of cell wall they have. But the important thing to know is that they are super common. They live in the intestines of tons of healthy people. Seriously, you, me, the person sitting next to you, odds are we're all carrying them around. And this right here is the key point to start with. In a healthy person, someone with a strong immune system, these bacteria are, well, they're just there. They don't do anything. They're completely harmless members of that huge, complex community living in our gut. So if they're usually harmless, what flips the switch? What makes them go bad? Well, it all comes down to the environment. Let's look at what happens when the conditions become, let's just say, perfect for them, but really, really wrong for us.
It really is a perfect storm. See, an infection usually hits when a person's defenses are already low. We're talking about a weakened immune system, maybe from being in a hospital or a long-term care facility. And then you have things like catheters or breathing tubes. Those can act like literal superhighways for these bacteria, giving them a fast pass right from the gut to other more vulnerable parts of the body.
And you can really see the two different worlds here, side by side. In a healthy body, the bacteria are no big deal. They're kept in check. But in a vulnerable body, whoa. Those same exact bacteria can suddenly become dangerous invaders. It's the same organism, but the outcome is completely, totally different.
So once these bacteria are on the move and out of the gut, they can cause some serious, serious trouble. Let's map out the common battlegrounds where these infections take place inside the body.
And the list of places they can attack is pretty long and scary. You've got urinary tract infections, so bladder and kidney infections. You've got pneumonia. And then there's the really life-threatening stuff like sepsis, which is a massive body-wide reaction to infection in the blood. They can also get into surgical wounds, burns, even the spots where IV catheters go in. And that is exactly why these things are such a huge worry in hospitals.
But here's the thing, it's not just a hospital problem. For instance, Klebsiella can cause a really severe form of pneumonia out in the community. It tends to hit older adults or people who already have weakened immune systems. Think folks with conditions like diabetes or alcohol use disorder.
And just to give you a real sense of how nasty this can get, listen to this description of one of the key symptoms. Yeah, we are not talking about your average cough and cold here. This is a severe infection, one that can even cause abscesses in the lungs. It just paints a really vivid and, frankly, pretty grim picture of the kind of damage we're dealing with.
Okay, so you've got a vulnerable patient. They're showing signs of an infection. How do doctors figure out exactly what's going on? How do they unmask the culprit? Well, there's a pretty clear playbook they follow.
First things first, it all starts with suspicion, right? Especially if the patient is already in a high-risk group. Next, they'll collect a sample. Could be blood, urine, maybe a bit of tissue. That sample goes off to the lab, where they culture it. Basically, they give the bacteria a perfect environment to grow so they can identify exactly what it is. And then, and this is the absolutely critical part, they test to see which antibiotics will actually work against it.
And that last step, finding an antibiotic that actually works, well, that brings us to the single biggest challenge in this whole story. This, right here, is the heart of the superbug problem. So the standard treatment is pretty straightforward. You get antibiotics through an IV, and when they work really, really well. But, and this is a huge but, there's a big if that's showing up more and more often.
And here's why. The bacteria you find in hospitals and clinics, well, they're often the toughest of the tough. Think about it. They've been exposed to all sorts of antibiotics over time. And what happens? The weak ones get killed off, and only the super-resistant ones survive to multiply. That's what makes these infections so incredibly hard to treat. And that, my friends, is why we call them superbugs.
Which leaves us with this massive, critical question. We're basically in an arms race with these tiny microbes. They are constantly evolving, constantly figuring out how to outsmart our best medicines.
So the question is, can we keep up? Can our medical science innovate fast enough? It's a battle that's happening as we speak in hospitals all over the world, and honestly, the stakes could not be any higher.